share this too? Okay. I should have shared it to Historic College Park neighbors. Okay, so now we're getting ready for Facebook Live, and we're gonna be right on time. Woo! By the time this thing uploads, it's gonna be 3 o'clock. Yay! Yeah, I have so many challenges with technology. I just figured the best thing for me to do was to get started, you know. Okay. All right. So we are on Facebook Live, ladies.
Okay.
And now me to figure out how to go all the way with this. Okay. For some reason, now I am, it's showing as a thumbnail, but I want to, okay. All right, we still got 30 seconds and then we'll be all the way live. Okay. Why can't I see? Oh, I know why I can't see it. Okay. All right. 10 more seconds. Hey, Facebook Live, we're here getting ready for our COVID-19 Community Health Connection Workshop. Okay. All right. And it is 3 o'clock. Okay. Well, good afternoon, everyone, and welcome to the Ignite College Park Resource Center's Community Health Connection. And the purpose of the Community Health Connection is to keep persons in the College Park and Tri-Cities area aware of things that are going on health-wise. And we will also share, as you know, we plan to do this on a regular basis, and we'll be sharing information that will help you to stay healthy because really your health, you know, that's what, you know, there's so many things that we have in life that you have for a time, but your health and your body, that's something that you're going to need to have in good shape the whole time that you're alive. And I know that sounds ridiculous, but it is true. We've got some really awesome guests here today to join us during this for this workshop. We've got some ladies that are from United Healthcare, and we also have a physician with us in the studio via Zoom today, who are going to share with us some information about the COVID-19 pandemic. And many of us have been hearing so many different things, so much conflicting information. And so we felt that it would be important to bring a panel of experts today to really, you know, share the real deal and what's going on with COVID-19, but also to give us some resources to assist us in our families in the diagnosis of this, and also the prevention of the spread of this this pandemic that our entire world is facing. And so we have with us from United Healthcare, the first person that I want to introduce, and I'm going to ask each of the ladies to just give their name and just tell you a little bit about themselves, and then we're going to come back later and actually have them share vital information with you. The first young lady that I'd like to introduce is Miss LaShonda Edmond, and she is going to tell us a little bit about herself. LaShonda?
Hey, good afternoon, everybody. Thank you, Jamelle, for the invitation, for allowing us on your platform. Again, my name is LaShonda Edmond, and I'm the community outreach representative for United Healthcare. I tell everybody I have one of the coolest jobs ever, because I get to partner with amazing community-based organizations, just like yourself, from faith-based organizations to provider offices, sometimes retail stores, our senior community, anywhere where I can be a resource and just share information concerning Medicare. I really try to make sure that everyone understands how Medicare works, and especially if they're a member of United Healthcare, just to let them know what's available to them. And so we try to share this message in different capacities, from community meetings, educational events, sometimes to fun games. Any any place where we're welcome to just help out. I love to partner and love to be there. So thank you again for giving me this opportunity.
Awesome. And thank you for being on, and thank you for everything that you do as
Absolutely.
well. I
Absolutely.
also want to next, I'd like to introduce Miss Shay Norman. And Shay, just tell us a little bit about yourself. And
Yeah, thank you so much, Jamelle, for having us on. Again, it's really, really important for us to be in spaces like this where we can kind of come out of corporate box and have real conversations with real people, with our community. So again, my name is Shay Norman. I do work right now as agent manager of Northwest Georgia. I work with several really, really, really great people like whom you'll meet next, Dion Grady. But I've been in the Medicare arena with United Healthcare, but United Healthcare specifically, but for about 14 years now. So I've worked with members, worked on the corporate side, worked with agents. So I'm really, really intimate with healthcare. And again, just thank you for having us on.
awesome, awesome. Thank you so much, Shay. And next, we are going to hear from Dion Grady.
Yes, thank you, Mr. McKenzie, for giving us this opportunity. I absolutely miss the community. You and I met out at a community event. I love getting out there. I'm actually the person that's actually sitting down with our members in their home. I actually came from South Georgia, from Savannah, about 2 years ago. And I set root in Fulton County, the Tri-City area. At first, I wasn't sure, but I absolutely have found a home. I love it. I'm looking forward to getting back in the community and just helping our members and sitting down with them and helping them sift through Medicare and, understanding, what's out there for them. My job, and I'm like LaShonda, I have the coolest job, is to basically make them feel comfortable. I like them to smile. When I leave, I want a smile on their face, and I want them comfortable with their Medicare. So I'm looking forward to it, and hopefully we'll be back in the community soon.
Awesome, awesome. Thank you so much, Dion. And next, we have Dr. Ingrid Van Orden, who's from College Park, the city of College Park.
Hey, again, I am Ingrid Van Orden. I'm a physician. I've tried to put together a few points for you all to think about as we are sifting through a lot of conflicting information. And I live in College Park. So I appreciate Janelle and Ignite College Park for giving me a moment to talk with y'all.
Okay, awesome, awesome, awesome. Thank you so much, Doctor. And so we're going to just for what we came here today. We're going to start talking about exactly why we're here, and that is to share vital information with you, the community, about COVID-19. What are some of the again, what are the things that we think that may we've hearing things that may cause this disease, but the main thing is how can we protect ourselves and care for ourselves if we're diagnosed or before to prevent the spread. So to prevent the spread, to protect ourselves, and how to care for ourselves and our loved ones. And so I'm going to turn it back into the hands of LaShonda, and just if you would like to share any tidbits that can help the community, and then we'll run back through and give each of our participants a chance to speak about that.
Thank you. As a community outreach representative, just on an educational or just sharing information, if you are a red, white, and blue card carrier, my Medicare people, I'm speaking to you because I work directly with that community. So if you are turning 65, if you are currently gracefully blessed to be 65 plus, or if you're permanently disabled, just some of the information I just want to let you know that's available to you. On a federal level, you have extra help, which is a low income subsidy, Medicare prescription Part D coverage or discount that's available to you, that you should either partner with the Grady's, Dion Grady's of the world, that can help you apply for extra help and share some of that information federally that you should apply for. You can either apply online or they can mail an application to you, but it's a federal discount to help you on your prescription drug coverage. On the state level, there is a type of Medicaid to help you called Age Blind Disabled Medicaid. And this is all for low income subsidy, individuals low income. I always tell people it never hurt to apply and just to see what's available to you through that regard of just state benefits and a federal benefit. But I want to make sure that Dion and Shay, I know they have some information on the national level as well through United Healthcare.
Well, that being said, let's hear from Shay.
All right. And before I talk about United Healthcare from a national standpoint, I know that we're focusing on COVID-19, and I'm really, really glad you have your doctor on, and also Dion, because like I said, she does sit with people need a need and help them with their benefits. But even if you're not on Medicare, we're going to provide an emotional support line, hopefully by the end of this. So if you are dealing with some stress, some anxiety, you just have questions, then this line that United Healthcare provided is not just for members or employees, it's for everyone. So just like LaShonda was saying, if you are, age 65, or if you have some disabilities, there are some things that we can do for you in regards to Medicare. But outside of that, we still want to encourage you to also give Dion a call, because she may be able to help you outside of Medicare. It's just really, really important to stay tied to good information. And so I know some of you may have missed some of these headlines. So I'm going to pull some of them, some information about United Healthcare out of the headlines, because it's really important when you're choosing a healthcare company, or if it's your healthcare company, you want to know what these companies are doing in the world and in the nation, in the community. I know it's really important to talk about what they do for you, but just a couple of things as far as what United Healthcare is doing. And I know I'm here representing United Healthcare, so it might seem like I'm biased, but I'm pulling these things out because I'm really, really tied to the community, and I understand our health disparities and our income disparities. And so just a couple of things. United Healthcare has provided an initial $30 billion in emergency funding to healthcare providers, those on our front lines. United Healthcare has waived cost sharing for COVID-19 testing and treatment for our members. So if you are someone out there and you're wondering, how can I get some coverage? How do I know what company is doing what? Just think about that. If you're having fear or you're having symptoms related to COVID, we do provide that at no cost for our members. Also, United Healthcare initially invested more than $60 million to help communities in need and to protect the healthcare workforce. I talked about the emotional support line. So hopefully we will have that for you in just a moment. And then lastly, I want to say that our telehealth visits for people who are stuck at home, they may not have transportation. You may be in rural parts, of the state. Our telehealth and virtual visits, we had more last month than we had in all of 2019. So to be able to say that this company is technologically supporting people from their homes is a big deal. Even if United Healthcare is not your carrier, make sure that the carrier that you have, you're able to access your providers online. You can do it through a smartphone. You can do it from your computer. So those are just some important points I wanted to bring up. But again, it's more important to know how United Healthcare can help you. So I'll, bring Dion on, because like I said, that's the work that she does every day.
Okay.
All right, Dion Grady.
Yes. So actually, I would like to share something, personal story that I have. I was in the community, actually at a community event. And some of you may have already seen me out at a community event with my table set up, or just volunteering, or just out there. I actually met a member. She had Medicare. She, didn't understand anything about Medicare. I was able to sit down with her and help her with Extra Help Part D. I noticed she did not have a prescription drug plan. Very important. I was able to help her with that. I also was able to help her to sift through understanding Part A and Part B. we were able to set her up with a managed plan to combine parts A, B, and D together. And I'm saying that to say shortly after she was hospitalized, she was rushed to the hospital. She was diagnosed with congestive heart failure. She actually returned from the hospital, and when she called me, we were talking, and she said, "I am so happy that that you helped me, and I had something, I had my United Healthcare." Not only was she happy about having United Healthcare, she was happy about what United Healthcare can do for her. One of the things that she was able to do is to choose her providers. She was able to go to a hospital of choice. She was also, when she came from the hospital, and I'm going to get into that shortly, we were able to provide meals for her for 14 days. So, we were helping her with her recovery. When you leave the hospital, understanding that those are the type things that, mean a lot to you, is to be able to have meals prepared for you. So she's doing very well, and she's very happy with United Healthcare. I would like to share something with you. I want to share this. This is our Clarity Workbook. This is something that I think is very important when you are new to Medicare, or if you're an existing member of Medicare. This is one of the things that I actually sit down and I take the time to go through this with our Medicare recipients. It's very clear to me that Medicare is very confusing. So understanding the basis first is very important. This is what we do. I'll be happy to also get one of these in your hand. If you would like one, you can reach out to me. My number is 912-755-3241. I'll repeat that. It's 912-755-3241. I'll be happy to get one to you. I'll be happy to sit down with you or answer any questions that you may have, because it is very important that you understand your Medicare and your options. Secondly, one of the things that I want to actually express is the importance of understanding what Shay and LaShonda mentioned. One of the things that I think a lot of members are not privy to is the information and the education out there. If your income as an individual is $14,610 as an individual, or as a married couple, if it is $29,160 or less, you may be eligible as well to get extra help. That is also something that I can assist you with. I can help you with extra help for prescription drug coverage. There's different levels of help. We're not going to get into that, but if your income falls below that, you may be eligible for that, and I can simply help you to apply for it. Those are some of the things that I help, our members with, ongoing Medicaid, anything that I can help you with, I'll be happy to do that. I want to speak briefly about some of our benefits. Some of the benefits that you may be able to take advantage of. Again, when our member came home from the hospital, we were able to actually have meals prepared for her. And those meals were actually up to 14 days for her. She was very happy about that. Some of the other vision, you are able to actually go get a vision check. You can actually go annually, and your lenses is included in that. So you'll be able to actually have your lenses as well. Dental. That's something that everybody is asking about these days. We've actually increased our dental. You can receive up to $3,000 in dental as well. We offer at no additional cost. We have and I suggested this for our member that came home from the hospital. So we have now where you can actually have set up in your home, and we'll send the device to you. And that is our emergency response system. And it is a button. It'll be set up with your home phone or cell phone. And we'll set that up for you as a member and send it to you. So if you needed help, you can just press the button. In addition to that, last but not least, we actually have telehealth. So United Healthcare was on the forefront of this before COVID. And I'm very happy about that. You can actually call in now and you can actually get help. You can call to get a licensed physician. You can actually also dealing with depression, anxiety, mental health. We have a dedicated telehealth line for that as well. These are just some of the few benefits that we have. We have a variety of them. I'm not going to go into all of them, but I just want to give you a general idea of what's out there. And just to let you know what, we as agents, what we're doing. This is why we're out in the community. We want to help you. We want to be able to educate you, but give you that peace of mind. So again, for those of you, I see that she's put it up there, the information. You can reach out to me today and I'll be happy to answer any questions that you may have. I look forward to getting back in the community. I think Miss McKenzie, Shay, LaShonda, and the doctor, the rest of you out there, Dr. Orton, know very well how important it is for us to serve our community, but I absolutely love getting out in the community. I miss you all very much, and I hope to see you soon. And if you see me out there at a table, at an event set up, if I have my table set up out there, stop by and say hello. Thank you.
Thank you. Thank you so much, Dion. And I'm glad that you and Shay and LaShonda have all talked about the services that are offered to people on Medicare and through United Healthcare, and even this emotional support hotline. Because a lot of times when we think about COVID right now, we're just thinking about the effects that the virus has on people's bodies, but we're not thinking about what people are going through emotionally. And then there are some people that aren't even trying to find a doctor because they don't think that they can. So this was really, really good information. And so now we're going to move on to Dr. Van Orden, who this is just some information I'm putting up on the screen right now for anybody that might be watching that needs assistance through Ignite. We are connected to United Healthcare, so you can reach out to Dion Grady directly, but also if you have other needs, clothing, food, utility assistance during this time, we are doing referrals and assisting people. In fact, we just got news today that Fulton County actually has gotten some funds that are available to assist people with utility payments, rent payments, and mortgage payments. So this is the number for Ignite. And again, we are working alongside with our healthcare providers. So at this time, as Dr. Van Orden comes, she's going to pretty much be discussing with us some things that are pertinent to COVID-19 and how we can protect ourselves. And so at this time, Dr. Van Orden, we're going to turn it over to you. Thank you.
Hello. Okay, first, I think that citizens are getting many confusing messages in Georgia. So I want to just emphasize first that please know that the Centers for Disease Control recommendations for social distancing have not changed in Georgia. They are the same as they were 3 weeks ago. And yes, I know that I agree the CDC is not a perfect organization, but the CDC has made these recommendations with your health first in mind. We put together a flyer recently that Janelle, I'm not sure if you've had this on the website or not, but this was put together with those recommendations in mind. Why these recommendations? First, I want to be clear that a person who is not having symptoms can spread the virus. And yes, the person that they spread it to can get very sick. Second, the virus can survive up to 3 days on some surfaces. So just to look at the flyer together, the We need to be keeping our distance still, about 6 feet apart at least from other people that are not living in our household. A mask is now being recommended. That came in several weeks ago, but please know that having a mask on does not substitute for staying at least 6 feet apart. So first you want to be sure that you're keeping your 6 foot distance. Second, it would be good to have a mask on as well. Okay. All right. Other things that the CDC has recommended is that if you are sick, experiencing symptoms of COVID-19, you're greater than 6 or equal to 65 years of age, you have some sort of chronic illness, it's best for you to be staying at home. When you do go out, if you must, you're going to be avoiding crowds, you're going to be wearing your mask, and you're going to be keeping that 6 foot distance, and you're not going to be doing handshakes. You can't even do the fist bumps, the elbow bumps. That doesn't work, can't right now. It'll come back someday, but now's not the time. And I'm not sure when that time will be, but it's not yet, okay? And one thing that we want to emphasize also is that cleaning surfaces and disinfecting frequently and washing your hands. So the next thing I want to just address for you is finally, where should you be getting the reliable information that we're all looking for right now about protecting your health? I do advise using the CDC for disease website, cdc.gov. You're going to be able to avoid the rumors, the distorted theories, and get some useful answers. It's truly easy to use. I was very pleasantly surprised. I've used their website before for travel advice and got a bit lost in the weeds. But the COVID-19 website is actually very, very helpful. It answers questions like how to care for a sick person, and you can even print information for your workplace. After viewing this program, I'm going to talk for a moment about people with underlying illnesses. But after viewing this program, I suggest that you go ahead and go to the cdc.gov website if you haven't been there yet. And you go to the first page and it has COVID-19 on it, and spend a few minutes on the site. I think you're going to really find it easy to use, and I think you're going to find it's actually very helpful. And it is information that is based on science, and it is information that is working to protect your health first and foremost. And I think that's something that we all really are searching for right now, and we need. I want to address this issue or question around doctors and how it's important right now for many of us to be accessing our doctors. Many of us have ongoing medical problems that may put us at higher risk. Heart disease, diabetes, breathing problems. Maybe you need an inhaler every once in a while. And you can go to the CDC website and you'll find a broader list of those problems. Any reason that you may be immunocompromised, whether it's because you're taking particular medications or because you have some underlying disease that happens to make you immunocompromised. This is a good time for you to call your doctor. We need to be sure that your medications are dosed where they need to be. We need to be sure that your vaccinations are up to date. Be sure you know when to call if you do start feeling sick. Talk about how you're doing right now. These questions are very legitimate at this time. It is you can think of it as a maintenance visit, but these are the sorts of visits that the CDC is recommending for people who have underlying illnesses, so that you can be sure that you're in the best health possible if you should get unlucky and you should get the disease, frankly. Fortunately, the ways to visit your doctor have changed. As the previous speakers mentioned, physicians are now getting reimbursed for telephone call visits, and they're getting reimbursed for telehealth visits. And they are taking appointments for these types of visits. So you're not going to sit on the phone, and you shouldn't be sitting on the phone. You'll call, get an appointment. They'll call you up. If you lose the phone, call the telehealth. I understand that they can get on the phone with you, and they are getting reimbursed for these visits from all providers, as far as I understand. And I want to tell you that if you have particularly an underlying medical condition, your questions about how you should be maintaining your health right now are legitimate, and they deserve the attention of your physician. And prevention is worth a pound of cure, right? If I do want to say, if you don't have a doctor right now, perhaps you've been using urgent cares or emergency rooms to get access to urgent medical questions that you may run into. This is a good time for us all to be revisiting habits that we have, right? And out of these sorts of events, many times we're able to make changes that we weren't in the past for whatever reason. And I'm hoping that with resources that you've heard today, and maybe through your employer or your previous employer, you can somehow establish a medical home. And that would be very helpful for you if you are running into problems during the next couple of years or a year or so that we're dealing with this, but not only for that, but also for your general health. Thank you.
Thank you so much, Dr. Van Orden, and thank you to all of our ladies. We thank you, LaShonda and Shay, Dion, and this has been awesome for you taking out the time. I really want to thank each of you, because United Healthcare actually reached out to our organization and wanted to make sure that the community was being made aware of the resources that are available to them. And Dr. Van Orden has been working diligently with me to assist in any way that we can to help our population here in College Park. Really appreciate the four of you. I know we said we weren't going to take any questions, but I do want to acknowledge the fact that we have two of our councilmen that I can see that are on the call today from the city of College Park. And I just wanted to give Councilman Ambrose Clay and Councilman Ken Allen just an opportunity to address us before we get ready to leave in the call for today. So either one of you would like to speak first, as we'd love to hear from you. And thank you again for getting on and showing your concern for the community.
Well, I'd just like to thank everyone who participated in this. I'm running on backup power right now. We had a tree take down our power lines, and I'm communicating over cellular, so I was conserving bandwidth earlier. But I guess I'm coming through all right. So I guess I've got a good cellular connection. Anyhow, yeah, and I would suggest that if you go to my website, clayonconsul.com, I have posted a number of links to CDC and the county, Fulton County, the state, Georgia Municipal Association. There's a whole bunch of links there that you might find useful, as well as I'm posting notices on various things that have come up in the city that are opportunities. I think I have the Ignite notice up there and a number of others. So if you want one spot that you go, it also has links to all the city connections. So if you want to tune in on a council meeting, you can go to my website, click on a link, and it'll lead you either to the Facebook page or the YouTube page. So thank you again and have a good day.
Thank you. Thank you. Councilman Ken Allen?
No, I just want to thank everybody for being involved. I think the more we know, the better we are. The more things that we find out are happening. We just got a message from Chief Elmore, and he said, just briefly, starting tomorrow, April the 28th through May the 4th, members from the Georgia Department of Public Health and the CDC will be visiting selected homes in Fulton County and DeKalb County to get blood samples, to answer surveys. So they'll be coming with badges, with identification and everything else. I'm not sure if they're going to get how many they're going to get in College Park, or even if they're going to get any, but they'll be in Fulton County and DeKalb County trying to get some information to help out determine, what's going on with this virus. If these people have had it before, if they have not, but they'll be identifying themselves if you see these people around.
Thank you. That's some good news to know, because if somebody came knocking on my door, I'll be like, I'm sorry, I don't know about that. But thank you for informing us of that. And again, we want to thank you all for taking out the time. I want to thank everyone that is watching us on Facebook, and those of you that are on Zoom with us right now. Share this video. It is going to be on Facebook on the Ignite page, and it will be posted here. Please feel free to share this with anyone you know. And again, let's just emphasize to people that there are resources out there. There is help. We should be calling our doctors if we have any concerns about health conditions and we're seeing symptoms. You don't have to go to the doctor now. They're actually seeing you on the phone. And we're also learning that there are telephone lines that you can, United Healthcare will have the emotional support. Many of us who have lost loved ones or have loved ones, even for those persons that may be hospitalized right now with COVID and cannot see family members, but you can be on the phone. And the emotional support line, that's a great way to just to get the mental and the emotional help that you need during this time. And we just want you to know that our prayers and concerns are going out with the entire College Park community, the state of Georgia, the United States of America, the world at large. We will get through this, but we've got to take things one day at a time, and we've got to listen to what we are being told to do. And I believe that we'll get through this just fine. So thank you again for joining us today. Thank you to our participants, our doctor and our United Healthcare specialist. We appreciate you. Our council people, we appreciate you. And Ignite College Park Resource Center is signing out right now. Have a beautiful rest of your day. And thank you again.
You too, Jamelle. Thank you.
Okay.
Thank you, Jamelle.
All right. Thank you.
Bye-bye.
Bye-bye.